Unlike previous rounds of COVID vaccines, this group is made up 100% of children, and of those, all school age. Olmsted County Public Health says that means staff and community partners are focusing on how to distribute the vaccines to make it as easy as possible for parents, and that likely means involving schools. Pfizer is seeking approval for a low-dose COVID-19 vaccine for kids 5 to 11 years old. And if all goes well, the request could be granted by Thanksgiving.
That last big group that if we can offer protection to, at that point, then it's really about personal choice.
That means the Olmsted County Health Department, along with partners like Mayo Clinic, OMC, and local pharmacies, are working together to figure out the best game plan for a rollout.
You've always got to consider younger children differently. It takes a different skill set to vaccinate a young child than it does an adult.
Health Director Graham Briggs says there's discussion of mini mass vaccination clinics at elementary and middle schools that would be made possible with vaccination permission slips.
We're talking to the schools about potentially putting vaccination clinics right within schools. We definitely want to be thinking about equity and access so that parents that may not have the time or the resources to bring children to the doctor for a specific visit, we want to make sure the vaccine's easily available for them too.
With nearly 20,000 children in Olmsted County who would be eligible, Briggs hopes parents will take this time to truly consider vaccinations.
I think at this point it's prudent for parents to start thinking about, number one, if they want to get their children vaccinated and how that potentially keeps both the parents and the children safe. It decreases transmission at the school and in the community. And ultimately, the fastest way for us to get out of this pandemic, keep kids in school, keep people from dying, is to get vaccinated.
Briggs does tell me that he doesn't expect the storage or handling of this lower dose of COVID-19 vaccine to be any different than previous doses. Live in Rochester, Jessica Bringy, KIMT News 3.
Thanks, Jess. Pfizer is also developing vaccines for babies and toddlers under the age of 5. They are not expected to be ready before next year.